Hey there, and welcome. If you're gearing up for shoulder surgery or just curious about what it involves, you're in the right place. We're going to break it down into 3 easy sections: what to do before your surgery, what to expect the day of, and how to handle your recovery afterward. Let's get started. Around 2 weeks before your shoulder surgery, it's time to start getting everything ready. First, you'll want to arrange for someone to be with you, ideally full-time, during your first week at home, and transportation for 6 weeks. Shoulder surgery is a big deal, but having support around makes a huge difference. Next, think about your home setup. You won't want to be reaching up or over too much after surgery, so move items like your phone, water, and remote control to a height where you can grab them easily without straining. Simple changes make life post-surgery so much easier. If you're feeling up to it, doing light shoulder exercises before surgery can help strengthen the muscles around the joint. This can make a big difference in your recovery later on. On the day before surgery, make sure to shower and follow any instructions from your care team to help reduce the risk of infection. And when you're packing for the hospital, go for loose-fitting, comfortable clothing. It'll be easier to manage after surgery, especially when you're wearing a sling. The day is here. When you arrive at the hospital, you'll be checked in and meet your surgical team. They'll take great care of you and make sure you know exactly what to expect. Before surgery, your care team will take your vitals, like temperature and blood pressure, to make sure you're ready. You might feel a little nervous, but the staff is there to answer any last-minute questions and to make you feel comfortable. Whether it's a rotator cuff repair or total shoulder replacement, your care team will update your coach or family after surgery. After the surgery, you'll spend about an hour in recovery. It's normal to feel a bit groggy and you may have some discomfort, but the staff will make sure you're as comfortable as possible. While in the OR, you'll be fitted with a sling or shoulder brace to help protect the joint while it heals. Your care team will guide you on how to wear it and take it on and off during your recovery. This will be your constant companion for a while, and it's there to protect your shoulder while it heals. You'll need to wear it when resting and during most daily activities, unless your doctor says otherwise. When you get home, it's time to take care of your shoulder. Reclining chairs are great for keeping your shoulder in the right position while you sleep. And make sure to follow your care team's instructions on how to care for your incision and manage your pain. One of the first big milestones is getting clearance to remove your sling. This typically happens 4 to 8 weeks after surgery, depending on your type of surgery. Your care team will guide you on when it's safe to start moving your shoulder more freely. Don't rush it. Trust the process. Once the sling is off, don't forget to support your arm with your non-surgical arm when you take off the sling. Now the focus shifts to gentle exercises, like active circles on a smooth surface and pendulum swings, taking particular care not to actively move your arm. These exercises are crucial in preventing stiffness and regaining mobility. Little by little, you'll be able to do more. Let's start with getting dressed. Shirts that are 2 sizes larger than normal and have wide sleeves are your best friend here. When putting them on, start with your surgical arm, then pull it over your head and use your unoperated arm to finish the job. It may take a little practice, but you'll get the hang of it. When it comes to bathing, you'll need to be careful with your incision. For the first few days, sponge baths are a good option. Once your doctor gives the go-ahead, you can let water run over your incision, but you'll want to keep the shoulder supported and avoid direct shower spray, scrubbing, or soaking. Eating may feel a bit awkward at first, especially if your dominant hand is the one that had surgery. If that's the case, you might find it easier to use a plate with raised sides to help scoop food. You'll want to practice using your non-dominant hand as much as possible before surgery. Getting up from the toilet requires some careful movement and focus, using your balance and leg strength. Use a grab bar or support yourself with your unoperated arm to make sure you're not putting any strain on the surgical shoulder. Sleeping will be different too. It's best to sleep in a recliner or prop yourself up with pillows to keep your shoulder in a safe position. Early on, you'll want to avoid sleeping flat on your back or rolling onto your surgical side. Pain after surgery is normal, but there are ways to manage it. Your doctor will give you medications to help, but ice packs and keeping your shoulder in the right position will also go a long way. And don't forget, distraction is key. Watch TV, read a book, or have a chat with friends to take your mind off it. Remember, recovery is a process that takes time, but with the right steps, you'll be back to your daily routine before you know it. Don't hesitate to reach out to your care team if you have questions or concerns. They're here to help. Thanks for watching, and best of luck with your shoulder recovery.